first of all, whatever may be this thing, and another thing, whatever may be the scheme, it is should be enforced in a proper way and ensured that it is taken by the children. For example, we are introducing millet laddus in Puducherry. Next week, millet laddus are given to the children. So such things, when it is given in the schools, no, burfis can be given. Coconut burfis are more nutritious. So children nutrition can be taken in that way. And preconceptional stage itself, mothers during marriage itself, and this vaccine, Indian vaccine to prevent cervical cancer, that should be propagated. And one thing is that women health should be the primary factor for everyone. And school also, continuous education should be there. 1 hour in a month or 1 hour in every 15 days. Health education for girl children should be there. Particularly in the adolescent age, they are unaware of the bodily changes, and mothers are not very competent to explain it. When it is taken in the school level, it will be very good for the children. Second, awareness about the hygiene. And Swachh Bharat, as you said, most of the dropout girl children, they've experienced dropout because there were no toilets. So toilets are very important, and even developed states also lack in good toilets. So we have to concentrate on that. So then coming to the neurology, nephrology, cardiology problem, first her mental well-being, her physical well-being, and somebody told about gym in her. So they should make serial. When you see the serial, you walk. Don't cry only. you try walking and then do some yoga. So because everywhere we cannot give equipment, so that awareness also. Don't going on sitting and seeing. Constantly, because now IT people, we are telling, no, you sit and then between you close your eyes for some time, and then and another thing to be concentrated is IT female professionals. All problems, the poor girls are facing delayed marriage, PCOS, obesity, and lack of nutrition. And there was a study in Telangana, fertility problem also. There was a study in Telangana, one of the NGO organization went and opened the tiffin box of each and every child. That happened in Telangana. And 90% of the tiffin boxes had burgers, breads, chips. No traditional food at all. So this awareness should be created among the women. Please do some idlis. Idli in dosa, at least each and every time you have to put dosa. And some idlis or some pongal with all legumes, everything can be done. So cooking awareness with nutritional aspect, because obesity is more, because children, they are given 10 rupees, okay, you get something. So they are getting something and they are eating that what they are. I always said, we are calculating our currencies, but we are not calculating our calories. So that is very important. So from the beginning, calorie maintenance and physical activity, nutrition, that will curtail most of the disease, first phase. Second phase, what all the problems, for example, neurological problem, gynecological, endocrinological, what all the problems sorted out. And it should be concentrated in the medical checkup. Mostly her medical checkup confined to, gynecological, this thing, everything should be included in that. And female ICUs, female wards, a little more in number, and mobile clinics for females. Mobile, because they won't come, they can't come. And mobile health checkups for women, particularly rural women. And we have to concentrate, because haphazardly we can say every ration card, every Aadhaar card, we can have a data, and we have to concentrate. If a village is there, it is not the 10 village person, 100 village person. Every person should. In National Health Mission, we are doing that. I don't know whether states are doing that. Because I am directly in the under administration, I am telling about Puducherry. And all these things, if it is done, definitely women will be very happy. And instead of some sanitary package, because Red Cross gives a package like that, sanitary pads, some disinfectants, some solution, some towels, like that. So if we want to gift a child, girl child, we can gift them with such activity, such things, this thing. So from the school level, we have to. This is more hygiene and nutrition. First, we have to come in a phased manner. We can go, and I appreciate all the specialists who concentrated on, as it is said, more incidences are there, and even they think heart attack also they won't affect, because after menopause we know the incidence in women are more than men. But another thing, families are not allotting money for their family health checkup. The budget, first thing cut in the budget is women health. And women also, we have to, I always narrate on incidents when we were house surgeons, postgraduates, there will be one exhibition that I have already narrated in some of the conferences. The sari shop will be there, jewelry shop will be there, cosmetic shop will be there. So we pleaded our head HOD so that we all postgraduates collected money. I always, in social perception, it's not only after I became the governor, from my postgraduate days itself, I had a very social outlook, so something should be done. So we collected money and we hired a stall, and we had charts and all for how breast cancer will be diagnosed, and then we had a pap smear, and we had a mobile mammogram, everything we had. And we had we wore our coat, and with stethoscope we were all sitting. These ladies used to come. First they enter the sari shop, then we will be very eager to, they will be entering. Very fast they will cross us, then they will go to the jewelry shop. So they are not also interested in, so they think that nothing will. So women also should have, then they will tell, even for a husband, if they are stomach pain, gastroenterologist should see, should consult, and if a child is having headache, they will consult a neurologist. But if they can, then kitchen they will go, they will take some asafoetida, some pepper, and they think they are sacrificing. That sacrifice, it is not good for the family also. So first of all, awareness, and then happiness, and yoga practice, and institutions, and mothers should be taken care. I always, whenever I talk about yoga, I used to talk about women sari yoga. So traditionally, they immediately, they told, no, I don't have the yoga dress, so I won't. So naturally, with the life pattern, for women something should be taught. Otherwise, if you want them to take away from the family pattern and traditional pattern, they won't. So go with them, along with them, collide with that, and then we have to. So these all things, because you all have done, did very good, but in added points only I am telling, because they have covered very well. Even though we gave 2 minutes, I really appreciate you. They have done very well.
Madam, that's why women in leadership is needed. And most important is, we tell, when, especially during election time, when people come and ask votes, we tell them, ask them to do health camps.
Yes. And TB Mukt Bharat by 2025, our Honorable Prime Minister wants India to be TB Mukt, and the Nikshay portal. Actually, Raj Bhavan has adopted 100.
Cervical cancer Mukt Bharat.
That government schemes, if we align with them, it is very easy. But we are not doing that. So that was what all the sickle cell anemia free. So these all things we can. Endometriosis, I have to say. Endometriosis is very common, and it is not identified properly. And I have my own experience as a sonologist. When we diagnose endometriosis because of some disparity in the myometrium, mostly before and all they won't accept. But after that, I myself have presented a paper of with just the thick myometrium, maybe endometriosis. And the pain they experience is something, so that is, should be aware of it. So these all things are almost every in the country. And another thing, ophthalmology. In Puducherry, we are practicing one model without ophthalmoscope, artificial intelligence incorporated into the cell phone. Just like that, looking, they are now blind free Puducherry. Like that, we have got one instrument is 60,000 only. Ample amount of instruments can be got, any number can be got, and even non-trained person can, just they have to look into that. And it is focusing the whole of retina. So particularly diabetic retinopathy and all, very early diagnosed. One person came and told me, so we have implemented it, and now they are picking up very fastly. I was very, so artificial intelligence in diagnosis also, particularly this the cell phone, Apple cell phone. Yeah. Yeah. Very good. So that is also doing very good.
Yeah. So, Madam, I'd like to add all the inputs that have come here. We will share at a startup event, and they will look into it and maybe come out with some medical devices. Like non-invasive diagnosis is very popular. India's first unicorn is a diagnostic company which is valued at 9,000 crores today. It is called SigTuple. They don't invade the body, but they can diagnose cancer. They can diagnose anything practically in seconds. So all the recommendations I'm going to share at a startup event so that they'll come out with medical devices. Now India has come out with a medical device policy. So a lot of good things might emerge.
Yes. In startups also, medical devices particularly, little more encouragement can be given to them.
So may we have the vote of thanks?
Yeah.
I request Dr. Vasuprada to propose a vote of thanks.
First and foremost, thank you, Your Excellency, for a wonderful space you have provided for this event to happen. And thank all the professionals, all the doctors who have taken time out to give their bits of very relevant wisdom. And we thank the staff of Madam who have made everything possible here, and the staff of Raj Bhavan who have also helped us have our tea earlier, and I'm sure there's something ahead. And with this, what I would like to, again, of course, our members from the press, thank you very much for covering this event, because as you know, this is something that is working towards the health of women. And we all know that in a home, we call a woman Gruhalakshmi. For the nation also, a woman is still the Gruhalakshmi. So thank you, Madam, once again for this wonderful event. Thank you.
So this effort should be consistent, and till the good policies are made. Another thing, this day, spending so much of, I always say, call sheet of actors, doctors is equal to a call sheet of doctors, actors. So spending all your busy schedule, all specialists, almost a specialist hospital is here, specialty hospital is here. So yeah, really very happy. I know the value of every minute of a doctor. Thank you. Yeah. Very good. Very good. Okay, thank you.